All right, welcome to another episode of Real Physician Reacts. I am your truly Dr. Barry Pierre, your favorite board certified internist. If you are overwhelmed by this healthcare system, underappreciated by this healthcare system, you're looking for a voice reason, you have found it. Again, if this is your first time catching this series, this is our series where week to week I come on and just talk about topics that either hit my timeline, that either hit my DMs, or something I just feel like, all right, I got to get off my chest. And excuse the background, especially for those who are watching in our YouTube channel. Excuse the background. I'm actually out of town. I'm actually at a conference, internal medicine conference, where I'm going to be doing a presentation on our topic tonight, which is just bias in medicine. And I talked about this kind of periodically throughout this this journey of stuff I do online. How unfortunately bias has been so ingrained not only within society. Again, just look on your TV, depending on which network you're looking at, you're going to have a different perspective on different people. But when you talk about medicine in general, you would hope that in healthcare we would leave our bias at the door. Unfortunately, that's just not the case. And unfortunately, not only do the people who are within the system get affected, aka the patients, the ones we actually have to take care of, but more worse is the people who are working within it as well. So the medical students, the doctors, the nurses, everyone is affected because bias has unfortunately been ingrained in our system. And this week, I'm actually giving a presentation with a couple other great colleagues on just the different aspects of bias within healthcare. And the bias is so great that we actually had to split it up. Like, so someone's talking about gender, someone's talking about race, right? Someone's talking about culture. Like, we actually had to split up multiple different factions of bias within healthcare because there's so many different factors and so many different people who are affected. And I say one thing, that if it affects someone who works on the system, like, again, the doctors, nurses, it's going to affect the people who are supposed to work for, which is you, the patient. So I'm actually talking about race. I'm actually talking about culture. And just to give a quick, story time. I know y'all like story time. We're here, we're sitting down at dinner, a couple of colleagues, good friend of mine, and we actually get introduced to this medical student who is concerned because they are dealing with, feeling underappreciated. They are dealing with feeling overwhelmed. But it's not because of the healthcare system in general. It's from the people who are supposed to be training them, right? The people who are supposed to give them direction and get their skills better are the ones who they feel underappreciated by, who are the ones that they feel, overappreciated and underappreciated. I'm sorry, by, right, and feeling overwhelmed. And when we talk about this aspect of healthcare, like, it's not a shock, it's not a surprise that certain demographics, especially Black people, right, get worse healthcare. It's not a surprise that worse expectations, worse prognosis. I was on. It's not a surprise because our system in and of itself looks at certain communities that say, hey, you know what? If you got this certain criteria, this is likely to occur. But they don't never actually address why it's likely to occur. They just say, hey, you know what? If you're Black, you're likely going to have, colon cancer at a younger age and all those other things there. But they never really explain why is that a fact. And more importantly, what is medicine doing to try to change that? It just kind of, unfortunately, go with the flow. So we're talking to the student who, again, clearly is concerned that, is this something that I am going to have to expect? And me and another colleague of mine, unfortunately, we're having to have this talk with the person that say, hey, you know what? Unfortunately, yes. Unfortunately, yes, this is a similar experience that I had to face as a pre-med, as a medical student, not really as a resident, that they had to face as a pre-med student, a medical student, even as a resident. Like, these are unfortunate experiences that we have to face because of this system of healthcare has bias so ingrained in it that it just continues to perpetuate it and teach it over and over again. So if you're watching this right now, you're listening to this right now, you're like, all right, so what does that do for me? Like, again, I'm the patient. Like, what does that do for me if bias is in there? This is how bias gets, pushed onto the patient. If you're Black, you have a history of sickle cell disease, and you coming in with pain. You know what bias tells you? Bias says, hey, you know what? They're not really in that much pain. I don't really need to go that quote unquote overboard and treating their pain. They can deal with it. Bias has, again, they did studies where, white medical students thought that Black people experience less pain than white people, right? Bias has it so that the maternal fetal rate for Black women is much worse than white women. Like, that is how bias trickles down to the patient. We just came from this pandemic, and I always say that the pandemic didn't bring up any new problems. It just kind of highlighted the ones that were there. So we know that, again, within this pandemic, we know that the people who died, mostly minorities, the people who were less likely to be vaccinated, minorities. Even when we talk about that recent monkeypox outbreak, guess who were the more likely people to be affected by it? Minorities, right? These are just systems that over and over again continue to perpetuate this issue that we as healthcare workers are just unfortunately kind of going with the flow with. So I'm hoping that, especially with this conference here and this presentation here that we're going to be doing this week, that we can open up a couple people's eyes. Now, I don't want to talk about the fact that, our session is like one of the early bird sessions. And if you've ever been at a conference, one of those sessions that are like real early in the morning, because they know a lot of people are going to be up and about, our sessions at that time. Something we'll address at a later instance, but it's still a fact that at least they're willing to talk about it. And if you hear, oh, I don't need to talk about bias regarding gender, I don't need to talk about bias regarding race, I don't need to talk about bias regarding culture, you are likely the person we're talking to. You are likely the person who is continuing to perpetuate, these ill thoughts, right, that just go into your level of care. And it's when we talk about this aspect, and I say it a lot, patient-doctor relationship is the most, obviously I'm married, but the patient-doctor relationship is the most important relationship you will ever have. Because when you have a great one, that is the difference between life or death. When you have a great doctor-patient relationship, that doctor is going to be one who's going to not only be able to say, hey, Barry, like your blood pressure's on the higher side, we need you to get taken care of. Hey, Barry, your weight's on the higher side, let's get that down. Hey, I need you to take these medications, let's do this for me. And because you have a great relationship on the other side, you're like, you know what, doc, you're right. Let me do what I need to do to take care of myself. These are life and death decisions that typically occur, on a day-to-day basis when you're working within the healthcare system. Now, again, I'm not saying immediate life or death, like, all right, if you don't do this, you're going to die tomorrow. No. But if you don't do this, in 5 to 10 years, your life isn't going to be as significantly healthy as it could be if you just take these directions now. So when we talk about this aspect of trying to eliminate, because we know society has its issues. When we're talking about eliminating healthcare eliminating this bias in healthcare, it takes the first step, which is, what we're doing this week is acknowledging that we have problems, and not even, not trying to belittle, like, oh no, it's not that bad, it's not that serious, or there's nothing. Like, I as a person who I think I'm very culturally competent and open, I go to these types of sessions. These are the types of sessions I get drawn by, because I'm going to these sessions thinking like, all right, what is something that I'm doing subconsciously that I'm not even realize I'm doing, but I'm doing it because that's kind of how I was trained to go. And there are things that I know I myself need to unlearn. So if I'm in a position where I understand that I need to teach a lot of things, and again, and when I'm talking about teaching, I'm teaching other doctors, right? I'm teaching other residents, I'm teaching other medical students, even the pre-meds. Like, it's a trickle down effect, because if you have one system where you have to leave your bias at the door for the greater good, it should be in healthcare. But unfortunately, it's not. The studies show that the same level of bias in regards to gender, in regards to race, in regards to culture, in regards to sexuality that is in society, just the general public, also exists within the doctors. So if we have not learned to at least check our bias at the door, you know who gets affected? You, right? Your mom, your grandma, your grandpa. Like those are the people who are going to get affected. And if I'm in a position as a professional, and my job as a professional is to take the best care of the patient in front of me, but there are ingrained bias that I'm allowing to creep in, either consciously or subconsciously, that will affect whether I decide, hey, you should go see this doctor versus that doctor, whether you should take this medication versus that medication. Even worse, whether I believe you when you're hurting. Like if that level of bias is not checked at the door, people will continue to die. I'm not going to say going to die, because what happened, it's happening now. People are dying now because of the effects of bias that we have not been allowed to check at the door. So obviously this is more of a, typically I do these educational ones on my Medicine Monday series, but I just figured we're here. I'm at a beautiful conference. View looks great. Let's talk about all the problems we got in medicine right now, right? Like it just is what it is. Because again, I don't want people who watch this, who consume my content, to think that like, all right, yep, the medicine healthcare system is all rosy, because it's not. Like it's had plenty of issues. It continues to have issues, but it's not until you get more people like me and others who are willing to say like, yeah, we got some problems we got to address. We got some problems that we got to take care of before something actually gets done. Like, because if we don't do that, ain't nothing gonna happen, right? So again, I am yours truly, Dr. Barry Pierre. This was our impromptu discussion on bias within healthcare. The homework assignment I have for you is, I just want, especially if you're on the patient side, I want you to kind of just look for it. Just see like, you know what? Are they treating me different because of my gender? Are they treating me different? Again, I'm talking about this, is my doctor. My doctor treating me different, right? Because of my race, because of my culture, because of my sexuality. Because if you get a hint of that, you have to let your doctor know, or you have to find another doctor. Because again, the decision could be life or death. And on the flip side, if you are a healthcare worker in any shape or fashion, and you're watching or listening to this, understand that yes, you have bias. So I'm not asking you, do you have bias? Yes, you have bias. Now, the most important thing we need to do is, how do we, one, recognize which biases we have and start to unlearn them? So again, I'm yours truly, Dr.